I'm going to answer them if I can, okay? One of my staffers is shaking the things, and there's all kind of questions, and I apologize, but there's a slide that I want to show you, this idea that you can keep your health insurance if you want it. That's been said a lot, but the bill doesn't say that. The bill quite clearly says something else. Section 102A says private insurance plans must offer essential benefit packages mandated by the federal government or be taxed. So they're going to decide. It says after 5-year grace period, individual health insurance coverage may only be offered through government-run exchanges. And private coverage will be unable to compete with the subsidized public plan. That is what I've heard that from the Heritage Institute. I've heard that from a lot of people. And I believe that, let me say this. Ronald Reagan said this, and I think it's right. The federal government, what they're going to do is they tax something, and if that doesn't stop it, they regulate it. And if that doesn't stop it, they take it over and they subsidize it. And I really believe that it's progression. And let me say this, I very much appreciate the fact that we have people on both sides of this issue. This is what makes a town hall meeting. If we all came and we all had one accord and one viewpoint, we'd just be talking, we'd be slapping each other on the back and agreeing. We need to ask these type questions. In fact, that question that I think is a common misconception, and that's that you can keep your own coverage, not what the bill said. Next.
We're going to go back to the box right now and start it. But listen, we had said we'd go to 8:30. If any of you that need to leave, please feel free to. You won't bother us, but we are going to continue until 9 o'clock, and at 9 o'clock, we're going home.
Yeah, we'll try to do this. We'll try to let a minute question, and then I'll try to limit my... Why don't I do this? Why don't I quit responding and just let people talk and say what they'd like to say about the bill? No? You want me to respond? Okay. Okay. Mark Clark. Okay, I'm sorry. Rachel Cleveland. While she is coming, the next question will be from Cheryl Matthews. So, Rachel, is Cheryl Matthews in the audience? Is she here? Are you Cheryl Matthews? Okay. Are you Rachel Cleveland? Miss Cleveland?
Hi.
From Trussell.
Hi. Thanks for having us tonight. I want to go back to the immigration topic just for a moment. What specifically are you doing to combat illegal immigration?
Thank you. I have voted for almost every piece of legislation that I got the opportunity to stop illegal immigration. I think it's an outrage. In fact, I visited Arizona. I visited the John Wayne Ranch and got up at 5:30 one morning with binoculars and watched people come across that border. And things are a little better on the border now. But one thing, in fact, there's a gentleman in Birmingham that I know very well. And this is kind of what I'd call unintended. Every time you pass legislation, there's an unintended consequence. So they passed a bill that you'd erect a barrier on the border. Well, of course, the environmentalists said we can't build it in the river. They're having to build it about a quarter a mile, a half a mile into Texas. So the United States is losing literally hundreds of thousands of prime farmland. And ranchers once that wall goes up, and it is a nightmare on the border, and it is really, I'll tell you something. Let me tell you, a number of people uninsured, the people that are uninsured, how many of them are illegal immigrants? I'll just use that slide and I'll quit. But as your congressman, I'm committed. I've gone down to the border, I've flown over it, and I'm totally committed to stopping illegal immigration. We actually have 11 million Americans that are eligible for Medicaid or S-CHIP, but have not enrolled. We have 9.7, the second largest group. The largest group is people who are eligible but don't enroll. And we have to think that with them, they probably don't need it. Okay? The second largest group is not citizens of the United States. Now, we offered an amendment, several of us offered an amendment in committee. I will support it on the floor, which says you're going to confirm citizenship. I think I said that. But anyway, 9.1% of the uninsured have an income of $75,000 or greater. They just choose not to have it. Most of them are healthy. And so what you're doing basically is you're going to take the remaining 3 or 4% of Americans, and you're going to tax everybody else. And we can't afford it. I won't put those slides up. But I do want to put up one slide. Now, this is something that everybody needs to know. We're having trouble financing our debt today. We can't pay back what we borrowed. Let me see the slide. I want to show you what our government did 2 weeks ago. How much money they borrowed. And while we're getting that, Ms. Matthews, if you'll ask your question, then we'll come. Well, here it is. Listen, in 2007, the federal government had to borrow $350 billion in additional funds. In all of 2008, they had to borrow $435 billion. Now, if you're not sitting down, sit down before I tell you this. Through July of 2009, this year, we have borrowed $1.5 trillion. Now, in 1 week, the week of July the 27th, and you remember the market got kind of shaky because the Chinese didn't buy anything? In 1 week, we borrowed half of what we borrowed, more than half of what we borrowed in 2007, and almost half of what we borrowed in 2008. And folks, we can't afford to do this. Chairman Bernanke, agree or disagree with him, and the Fed is a part of the problem. But he said, he came before the Congress, unlike Alan Greenspan, and he said, if you can't even continue to spend like you're spending. If you do, we're not going to be able, we cannot manage it. If you continue to spend like you're spending. Ms. Matthews.
You're on fire!
Thank you, Congressman. If this bill passes, can it be repealed?
You know, almost nothing is repealed once it passes. You know, every day I get a call from somebody saying, you know, this is a terrible piece of legislation. And they're unhappy with it. And, you know, it's not working like it was intended to work. It was supposed to fix a problem, and it created a problem. And that's one of my fears about this. We're rushing to judgment on this thing. And we need to address the problems we've got. We need to see if Ms. Watkins, if that's a solvable problem. We need to figure out, and we need to come to terms with not all the illegal aliens in our country, immigrants. Listen, I blame us for that. I don't blame them. I really do, because we're allowing that to go on as a country. Now, we need to seal our borders, and we need people, if they come here, they need to come here legally. We have people that have been 16 years from Europe, that their mothers and fathers of our citizens, they're sick in Europe. They want to come here and live. We don't allow them in the country. And we ought to have a much better plan. But Ms. Matthews, I could never assure you as your congressman that legislation, if it's passed, that it could be repealed. That would be an empty promise. Thank you. David Skinner. Mr. Skinner from Vestavia.